But 47% of all voters, 40% of Republicans, they will blame the GOP if Obamacare reform fails. Let's bring in former speechwriter for Richard Nixon and economist Ben Stein. He joins me now. Ben, is that the roadmap to get a deal done? Just get small bore reforms, get little things done to get your mojo back?
With all due respect, I don't think it is.
Okay.
With great respect, I think they have to have a plan. I was very surprised to see Mr. Trump blaming the Congress. Look, he didn't come out with a plan, with a comprehensive, detailed plan. Usually, if there's a comprehensive, detailed plan about health care, it originates at the White House. It does not originate in Congress. It should come down from 1600 Pennsylvania Avenue. He didn't really either have the time or the willpower or the experts to get that done. And I think they're going to have a gigantic effort on the part of the White House and the Office of Management and Budget to get a large bore program done. If they can't, obviously you're totally right, then they should do the small bore programs. But it is to me shocking that the president took office promising this gigantic, grandiose thing about health care, and he basically had no plans at all for it. It basically was just scratch it up at the last minute. That's not the way to run the government.
Yeah, you know, Ben, you make really valid points here, because what's happening is the market is up about $4 trillion since the president was elected in terms of market value.
Yes, yes, it's fabulous.
So,
I love it.
And tax reform is at stake. If you know, they can't even get it to a vote. So if they can't get it to a vote, this reform, I'm just suggesting that maybe get the doubles in there, get some victories in there under their belt, because it is about momentum. It's about mojo. The Democrats, as you know, they're spreading poison around that the GOP wants to kill people. And now Nancy Pelosi, just moments ago, said the budget will create violence. So they're going to be in the D.C. swamp again.
Well, Nancy Pelosi, I'm a lawyer and an economist by training, not a psychiatrist, but Nancy Pelosi is pretty clearly mentally ill, so I don't really pay much attention to what she says. And she is the ultimate divider and creator of wars within this country, so I don't pay much attention to what she said. But it is surely true there are things that the government can do, that the GOP, coming down from President Trump, can do that would improve health care in this country. I don't think that necessarily the things you suggested are the things that need to be done. But look, when we were in the Nixon administration, this is ancient history. Most of your watchers probably weren't even alive then. We came down with a many hundred-page document created at the White House and the OMB about how to have a health care plan. And it boiled down to this simple idea. We take a census of who can afford health care in this country. For those who cannot afford it, who genuinely cannot afford it, we buy them a policy from a private insurer. It was more complicated than that, but that was the essence of it. I don't know why we can't start with that. Just work through the existing fine insurance companies we already have and have them do most of the heavy lifting. We just write them a check for it. It's going to be a very large check, but health care is incredibly expensive.
Don't know if you can get both sides to agree on that. I mean, that'd be a tough road to hoe, because, you know, those tough conservatives who were against that big government spending, they didn't even like Medicaid expansion. I am just saying this. As you have pointed out, get something done. Obamacare was tweaked and changed nearly about 6 dozen times after the fact. Final word.
Let's get it tweaked and done for sure, but let's remember the big picture has to come down from Mr. Trump.